Good evening. Oh, that's loud. You want to move forward and take your seats, please? I'd like to remind you, if you haven't done so already, to silence your cell phones or other noise-making devices you may have, so please do that so we don't get interrupted during the course of the meeting. I want to welcome you to the Greater Boston Interfaith Organization, GBIO, in-district meeting in Lexington tonight. Hancock Church has been a member of GBIO for a little bit over a year, and we're proud to host one of these sessions as an in-district meeting session for them. I'm Jim Weston from Hancock Church.
And I'm Don Detweiler from Temple Isaiah.
And tonight we have with us three of our House Representative members. We have Michelle Socolo, Ken Gordon, and Tom Stanley. We thank you guys for coming tonight. We're really fortunate to have wonderful legislators who are willing to interact with their constituents here tonight. And to our audience, this is an opportunity for us to make sure our representatives understand our health care concerns and are accountable to us for taking action to make all our lives better. If you have not been to a GBIO meeting before, please note that this is not a town hall style type meeting, but it's focused really on getting responses to key healthcare issues. Our meetings will begin and end on time, and we have a timekeeper to assist us in that process. To the reps, as you know, we've given you questions, and we're going to be asking you for yes and no answers on those key legislative issues. There are many issues we could discuss, but GBIO has chosen to discuss three this year: mental health transparency, and out-of-network and surprise billing, and drug costs. We look forward to this interaction tonight. GBIO is comprised of many faiths, and to start off our meeting, we have a prayer by Reverend Barbara Callahan of Hancock Church.
Well, hello and welcome, GBIO. It is great to have you here at Hancock. Let us pray. God of all, what a joy it is to gather together from many faiths and traditions to learn, to hear, to witness, and to seek the common good. Thank you, Holy One, for the privilege of being a part of what you are doing in our communities and in the world. As we gather tonight to advocate for the human right of health care, we remember that across all faiths and among all cultures, your healing is known. You do not turn some away because of pre-existing conditions. You do not seek only to alleviate those illnesses deemed worthy of your time and attention. You model for us equal access to your healing presence. So inspired by the great love that you have shown us, make us agents of that same holy intention, the divine momentum that manifests your love and mercy for all whom you have created. We ask as well, Holy One, that you bless the work of our elected officials, Representatives Socolo, Gordon, and Stanley. Remind them of the communities that they have promised to serve, and inspire them to strive for justice, especially for those most vulnerable, that all may have access to quality health care. May the healthcare policies of this state and of this country serve to heal and empower all the people, rather than uphold power over the people by serving the interests of a few, so that all may be strengthened to live lives of joy and service. Bless our time together this evening, that we might listen and learn and take heart in the power and strength of your community gathered here now. In your many names we pray. Amen.
Amen. Thank you, Reverend Callahan, for that beautiful prayer. Thank you very much. Well, hi, everyone. We're so glad that you've been able to make it out on a weeknight with bad weather predicted. It's great that you could be here. It's obvious that you have a commitment to community involvement and a concern for owners' health care costs. Before we hear stories from up here about these issues, I'd like to tell you a little bit about GBIO. GBIO, the Greater Boston Interfaith Organization, is a broad-based community organization of over 40 churches, synagogues, and mosques, including tonight's congregations, Temple Isaiah, Temple Shir Tikva, and of course Hancock Church. We organize, at GBIO, we organize across religious, racial, ethnic, and neighborhood lines, working together to bring change for the public good in the greater Boston area. We represent more than 45,000 people, and collectively, we build power to seek justice by engaging with public leaders. The issues that GBIO decides to build power around come from sharing our own stories with each other at house meetings at each congregation. For me personally, working with GBIO has been truly meaningful. Instead of feeling angry, pessimistic, or frustrated all by myself, I can work together with other people to slowly build real power that can affect real structural change. And it feels really good when each step moving forward succeeds. I feel the strength of building relationships based on shared values with people from other congregations and walks of life, and it makes me feel like I'm truly participating in meaningful, holy work. This healthcare campaign started last spring with hundreds of house meetings across the GBIO congregations, where healthcare bubbled up as a major concern across people that came to those meetings. Then in November, just this past November, we held a public meeting, a big public meeting, attended by 800 members of GBIO congregations, where we met and heard from Senate President Karen Spilka, Chair of Senate Healthcare Finance Committee, Cindy Friedman, and Governor Baker's Secretary of Health and Human Services, Mary Lou Sutters, all of whom vigorously supported the work that GBIO is doing in healthcare reform. And just this past month, in February, we've held 10 in-town meetings like this one, engaging 25 state representatives, including our three honored guests tonight. So, what will this evening look like? We'll be following the agenda that you should have received when you arrived. First, we'll all have a brief opportunity to share our own stories with one another. Then we'll hear stories and testimonies from real people whose lives illustrate why these healthcare reforms are needed. We'll have specific questions for each of our three representatives, asking them for yes or no on their commitments. Each representative will then have a few minutes to address all of us. Finally, we'll officially end the meeting with a closing prayer by Rabbi Rachel Maiman. So, before we hear stories from up here, we're going to ask you to find someone you didn't come with tonight, and spend 5 minutes, just 5 minutes, talking about either why you're here or a hardship that you or someone you care about has experienced with healthcare costs. So please, take 5 minutes, starting right now, to speak with someone that you didn't come with tonight. Not your wife, not your best friend, someone you didn't come with. And you can shuffle around as you need to, move over a few seats, get up, walk around, move pews, or whatever it takes. We're going to talk for 5 minutes. Naomi and Michael, you know each other. You didn't come together. minutes went fast. So you can return to your seats now if you'd like, or you can stay where you are. But we're going to continue. We're going to be hearing from 3 people now from our local congregations who are going to share their stories about one of each of the 3 healthcare hardships that they've personally faced. Those being the ones that Jim mentioned: excessive prescription drug costs, lack of mental health parity, and out-of-network surprise billing. So these are going to be powerful stories, and we're going to hear them tell it from their hearts. I just want to ask you to show them your appreciation for what you're hearing. So this is a GBIO action. We have enthusiasm. We have power in our organization. So are we up to bringing some power and enthusiasm to this meeting? Yeah. All right. All right. Glad to hear it. I'm really happy to hear that. We're going to hear from these people, and after each story that we hear, Dr. David Barron, who is an internal medicine primary care physician, he's from Temple Isaiah, he'll be responding to the issues that were expressed. So each of these stories represent thousands of people in Massachusetts whose lives would be changed dramatically if our priorities are included in a bill that we hope will be voted on affirmatively. So I'll first introduce Wendy right here. Tanahashi Works. Please, go ahead.
Hi, my name is Wendy Tanahashi Works, known better as TW by my students. A member of GBIO and a Hancock Church member as well. Being the mom of a daughter with a mental illness has been a journey of pain, patience, and perseverance built on a strong foundation of love, empathy, and humility. Consider this snapshot. After multiple short-term hospitalizations this particular summer, the care team at Lynn advocates with our insurance to keep Erika, then 14, in the unit for long-term care in order to adjust her medications. Day 4, they call me early morning apologizing that insurance will not permit her to stay. I need to come to an exit meeting with the care team and Erika. I'm so disillusioned, so frustrated. I cry while getting my 12-year-old daughter, Emma, ready for day camp. On the phone, they reassure me that they have Erika on board and that she agrees to a safety contract to come home. I drive to the hospital singing Let It Be, which is my song of strength, full force, partly sobbing. I arrive, join the care team in a large conference room. Erika, highly irritated and volatile, ripping up the contract, yelling, banging her head. They call in 2 security guards, and I am told to take her home. I'm frozen with fear and anger. How can this happen? We get Erika home. 2 hours later, she climbs out the second-floor bathroom window and is on the roof trying to jump. We are back in the ER, waiting another 8 or 9 hours for yet another available bed at yet another adolescent psych ward, for yet another 3-4-day stay. I'm feeling so worn down, so angry, so frustrated by the systemic revolving door to mental health facilities. This needs to change now. Thank you.
Thank you, Wendy. Thank you so much for sharing that with us. Now we'll hear Dr. Barron respond and elucidate, if that's the right word.
Hello. I'm a primary care physician and a teacher at Harvard Medical School system. A little about my background so you know where I'm coming from. I trained at Cambridge Health Alliance starting in 1989 and never left. CHA is the second largest safety health net system in Massachusetts. I also served as chair of the Pharmacy and Therapeutics Committee and chair of the CHA Patient Safety Committees. On these committees, we often heard sad stories of vulnerable patients who could not get vital medications and services. At times, it was heartbreaking to know that many of these untoward medical events were preventable, and not due to errors in care delivery, but actual barriers due to insurance company practices. I see examples such as those you're hearing about today daily in my medical practice currently. So when I was asked to comment on these stories you're hearing today, I jumped at the opportunity to amplify their voices and verify their stories. In the bad old days, early in my practice, there were carve-outs in mental health insurance, in health insurance plans for mental health, meaning plans did not have to cover even routine mental health or substance use disorder care. I believe this practice has been banned in our state, as far as I know, for many years. However, biases persist in lack of parity with medical illness. Frontline practitioners are very aware that mental health conditions commonly coexist in an individual. For example, depression is very prevalent post-heart attack or stroke and commonly seen with diabetes or virtually any chronic illness. Coexisting mental health conditions negatively affect outcomes in these conditions if not well controlled. Delays in evaluations and placements of those in need of inpatient mental health or substance use disorder treatments are a pernicious example of the bias in healthcare delivery. Another example, I saw my patient Roger the other day. He was discharged from an inpatient facility after a 1-month stay for suicidality due to major depression a couple of weeks prior. His depression had deteriorated rapidly in the recent months, and due to the depression, he had lost his job and could now no longer pay for his room in the boarding house. Roger spent 15 hours in the emergency department before being transferred to a facility. It's fairly common that someone being admitted to an inpatient unit can spend 2 or 3 days in an emergency department awaiting a bed. During this time, they're not getting any treatment. Rather, they're simply under guard for their own safety in a very inappropriate environment. Certainly not helpful for their condition. Why is this? Because it takes hours for mental health providers, including physicians, nurses, and social workers, to negotiate approval with the insurance company. And once this is done, many more to locate an appropriate bed because of the lack of facilities in our state. This takes time away from evaluations, treatment, and monitoring, which should be the primary focus of these professionals. These delays and inefficiencies can be largely blamed on 2 major areas: barriers set up by insurance companies and lack of adequate workers, services, and inpatient facilities in our state. Legislation is needed to assure adequate inpatient treatment, more trained workers in mental health field, and improved support of mental health and substance use disorder treatment within primary care systems as well within our state network. Thank you.
Thank you, David. Next, we'll hear from Ellen Campbell, also from Temple Isaiah, to tell her story. Ellen?
Good evening. I'm Ellen Campbell. I'm a member of Temple Isaiah and a very proud member of GBIO, and thank you for being here this evening. When he was a toddler, my now 7-year-old grandson was diagnosed with severe allergies to beef and to peanuts. Thus began the need to purchase EpiPens for immediate availability wherever Alexander happens to be. EpiPens were first marketed in the 1970s. The medication and the pen used to inject the medication are relatively inexpensive. Multiple pens are needed for safety. Both parents carry one, grandparents often have one, and schools, camps, and daycare have them for emergencies. Reasonable pricing for pens is obviously essential. Over the last decade, the price for EpiPens has skyrocketed. My personal belief as to why this has happened is impure greed on the part of pharmaceutical houses. There are millions of people who carry EpiPens. The cost swelled to more than $600 for a 2-pack of EpiPens. The public outcry was heard coast to coast. There was a modicum of a response by Big Pharma, and the price came down slightly. There are ways of significantly reducing the price of the pens, but they are cumbersome and require some savvy. A mass-produced, life-saving medication that has been around for more than 40 years and is inexpensive to produce should be financially accessible to all who need it without having to jump through hoops. There is a generic pen available that can be purchased without insurance, very inexpensively, but requires the procurement of a coupon from the manufacturer. While that's an option, I still adamantly contend that life-saving medications like the EpiPen should be available with ease of purchase and a reasonable, affordable cost. Thank you.
Thank you, Barbara.
Ellen. You said Barbara.
Give this mic to David.
So here's my take on this. Medication costs are generally covered by insurance. However, there are several gaps, loopholes, and problems that lead to patients not getting medications in a timely fashion, even when they have insurance. Co-payments are one barrier. My patient Roger, again, same patient, just one example, needs 4 medications for his hypertension, asthma, and mental illness. But when he came to see me the other day, fresh out of his inpatient psychiatric stay, and now staying in the Salvation Army shelter, he was not taking any of his medications and starting to deteriorate again. Why? It was because each medication has a copay of $15. Since he has no income, this is a huge amount of money, which he needs to balance with his supplemental food and basic needs. Another common barrier that we see is what I call formulary switches. Insurance companies are allowed to restrict the medications for their patients to a limited formulary. A patient may show up at a pharmacy to get their refill only to find that the inhaler, which has stabilized them for many years and cost $15 the previous month, now costs $300 if they were to purchase it. Why? I like to ask why a lot. Because suddenly, without adequate notice, it's no longer formulary. Their options are either pay this huge amount or go home without, not realizing that there may be a reasonable equivalent for the same copay that they've been paying because they haven't been informed of such. Although this information is theoretically available to all pharmacists, a lot of people don't have the wherewithal to ask or advocate for themselves in that situation. So that's exactly what happened with Roger. I have seen insurance companies switch medications 3 or 4 times in the course of a single year, switch it from their formularies, often eventually returning to the original medication. To be clear, these switches are solely for the purpose of cost savings to the insurance companies, not for improved medications. Patients can suffer from this. If my patient Roger goes home without his medications, he may have an asthma exacerbation or again become suicidal, ending up in an emergency department visit, easily costing 50 times the cost of what the copay was, or worse yet, hospitalized easily 200 times the cost. There are secondary victims in this. The secondary victims are the healthcare providers themselves, like myself and other nurses who know about this, who are called upon to manage the frustration and unnecessary suffering of their patients as they or their nurses or pharmacists devote their time making calls and doing paperwork trying to resolve their patients' problems. Legislation that would reduce financial barriers for patients to get necessary medications would be safer medical care, increase efficiency, and reduce costs throughout the healthcare system. Thank you.
Thank you, David. Next, we'll hear from Laurie Bergstrom.
Good evening. I'm Lori Bergstrom, and I am from Woburn, and I am a member of the GBIO healthcare team here at Hancock. 2 years ago, I had a knee injury, and of course, I scheduled an appointment with my doctor here in Lexington at Beth Israel. She's my primary care doctor, and she's in network. After the examination, she ordered an x-ray, which is a standard procedure. The x-ray was performed on site during that visit at Beth Israel, Lexington. Weeks later, I was billed $225 for someone to read my x-ray. I was shocked because it was done at the visit in my primary care office at a Beth Israel facility. I made several calls to Beth Israel patient billing thinking this was a mistake that could be easily cleared up. After several conversations with the patient billing, they informed me that although my in-network doctor had ordered the x-ray, the physician who read the x-rays was out of network. I was completely surprised, shocked, and angry. The choice to use an out-of-network service provider was never mine, and yet I was billed for this substantial and unexpected medical expense. Shortly thereafter, I began receiving bills from a collection agency. Frustrated, exhausted, and angry, I wrote a letter to dispute the bill. Because the bill was charged directly from Beth Israel, I could not dispute it. I felt powerless, disillusioned, and forced to pay a bill for fear that my credit score would be impacted. Paying that bill required me to take more money out of my savings, which is decreasing rapidly due to the out-of-pocket medical expenses and increase in prescription drug costs that I have. I'm now retired with a chronic illness, and I am on a fixed income. I see many specialists and have a number of prescriptions which are vital to maintain the quality of my life. I also have a disabled daughter who needs specialized care and more medications. I know that in a few years we will not have enough savings to cover all the necessary procedures, scripts, and specialists to maintain our health. Due to our current healthcare system, I fear for the health of my daughter and for the many others with chronic illnesses. Our current and future health is compromised with ever-increasing and unexpected costs over which we have little or absolutely no control. I'm asking each of you to stand up to the healthcare industry and to help control the high costs of out-of-pocket co-pays and surprise billing practices. Thank you.
Thank you, Laurie. Thank you.
Hidden costs. Surprise out-of-network bills are a common cause of unexpected costs for patients. We see this very often. These bills may be thousands of dollars for patients who live paycheck to paycheck. As you probably know, medical costs of all kinds are the #1 cause of bankruptcy in our country, and this issue certainly contributes to the problem. As a primary care provider, it's not uncommon for a patient to bring their bills to me to try to get an understanding of why they got these bills and what to do about it. Many of these were tests or procedures legitimately ordered within network, but some portions were not covered because of aspects of care being out of network, such as Laurie's case, pathologist readings, other specialized imaging, and the like. Neither patients nor ordering providers have any way to see this in advance. Many patients do not realize they may be able to contest the bill, so they go about paying hundreds or even thousands of dollars or more, often in lengthy payment plans. If they do not, they're soon hearing from the collection agencies. Legislation that would greatly reduce or eliminate the problem of surprise bills would address an unfair burden to our patients. Thank you.
Thank you, Laurie. Thank you, Ellen. And thank you, Wendy, for sharing those stories with us. You know, these stories, they're so painful to listen to. They make me so sad to hear. But you know what? It also makes me really angry to hear these stories. I sometimes, it's so unfair. Something needs to be done about that. And that's what we're trying to do here tonight. We've heard the stories. I'd like to ask you in the audience, we have 60 people, I've been told, that came tonight. I'd like to ask you in the audience, if you or someone you care about has experienced hardships with one or more of these issues, I'd like you to stand up right now. Wow. 60 people, I would say almost all of you are standing up. This is incredible. And this is why we need to do something about medical costs. You can sit down, thank you. We definitely have to do something. We need to fix this. We need to fix this. We need to fix this. Do you think we need to fix this? Yeah. I didn't hear you. Did you say we need to fix this? Yeah. All right. We do. We need to fix this. And we need to do it soon. Anyway, I'm going to turn the meeting over now to Jim. It's going to calm things down. Right, Jim?
So when I hear those stories, I'm really affected by them. And then I think, those are only a couple examples of the thousands of stories that must be occurring each year in the Commonwealth of Massachusetts. So it's really time for us to think about what we can do to help other people. I mean, most of us are members of a faith organization, and part of our commitment is to be able to help others, and we need to look for a way to do it. That's partly why I'm in this with GBIO. So tonight, what we're going to do is we're going to ask our representatives for responses to the 5 questions which are printed on the back of your agendas. We're going to ask for a simple yes or no answer to them. You'll be given 5 minutes after we've responded to all the questions to say any additional comments you want to make and be able to do it. And our intent here is this and the 10 other in-town or district meetings we've had. We're compiling responses to those same questions with each of the representatives, and to be able to take that then to the House leadership and say, here are some of the issues we believe, GBIO believes is a priority, and we want to see some action this legislative year. So I'll start with you, Tom, in terms of the questions. The first question is relative to drug costs. Will you vote in support of health care bill that authorizes our government to publish proposed values for excessively priced pharmaceutical drugs? Yes. Thank you, Tom. Hey! Okay, we're on a roll. Let's keep it going. Drug costs. Will you vote in support of a health care bill that creates a $25 monthly cap on out-of-pocket spending on chronic disease medications such as insulin, EpiPens, inhalers, and naloxone? Excellent, thank you. Mental health. Will you vote in support of a health care bill that enforces stronger parity requirements for mental health coverage versus non-mental health coverage? Thank you. Surprise billing. Will you vote in support of a health care bill that eliminates surprise out-of-network billing?
I already have. Yeah. I will again.
Thank you. But now for the a little bit tougher question. For these reforms to become law, we need to be able to take action this legislative year, otherwise by the end of July. The Senate has started a good process. They passed a prescription reform bill and a mental health parity bill, but the House has really not shown much activity at this time. So one of the things we're now going to be asking you is related to getting a bill on the floor. As you know, the House leadership includes Speaker DeLeo, Majority Leader Mariano, Ways and Means Chair Alan Michalowicz, and Joint Committee on Healthcare Financing Vice Chair Daniel Cullinane. Will you, on behalf of your constituents, prioritize the passage of a comprehensive healthcare bill with House leadership, which includes the issues mentioned tonight, before the end of this session in July 2020? And will you report back to the constituents who organized this in-district meeting of your progress within 2 weeks?
Yes.
Wonderful. Thank you. Okay, moving down the line, Michelle, I'm going to ask you the same questions, of course. So first question is drug costs. Will you vote in support of a health care bill that authorizes our government to publish proposed values for excessively priced pharmaceutical drugs? Thank you, Michelle. Drug costs. Will you vote in support of a health care bill that creates a $25 monthly cap on out-of-pocket spending on chronic diseases, medications such as insulin, EpiPens, inhalers, and naloxone? Wonderful, thank you. Mental health. Will you vote in support of a health care bill that enforces stronger parity requirements for mental health coverage versus non-mental health coverage? Thank you. Surprise billing. Will you vote in support of a health care bill that eliminates surprise out-of-network billing?
Yes.
Wonderful. And the last one relates to the House leadership. Will you, on behalf of your constituents, prioritize the passage of a comprehensive health care bill with House leadership, which includes the issues mentioned tonight, before the end of this session in July 2020? And will you report back to the constituents who organized this in-district meeting in 2 weeks?
I'm not sure how much information we'll be able to garner in 2 weeks, since the House is about to enter into a discussion and debate on the transportation bill. So of course I can report back in 2 weeks, but we may not have all the information and answers we want at that point.
We will follow up with you. Thank you.
Is that a yes? Is that a yes? That's not a yes.
That's a yes.
Oh, that's a yes.
That's a
Okay,
yes.
good. Just checking.
And Ken,
Yes.
going back to you, the same 5 questions. Drug costs. Will you vote in support of a health care bill that authorizes our government to publish proposed values for excessively priced pharmaceutical drugs?
Yes, but I've already filed such a bill with respect to mental health care that was signed into law. I think that was in 2015. We can talk more about that, but we've done that.
Great. I'll take it as a yes. Thank you.
That was a yes.
Drug costs. Will you vote in support of a health care bill that creates a $25 monthly cap on out-of-pocket spending on chronic disease medications such as insulin, EpiPens, inhalers, or naloxone?
Yes, and as a caveat, I've filed a bill that would require schools, public schools, to make the inhalers and EpiPens available to their students in a way they don't do now.
So it's a double yes. It's not only yes, but you'll do support. Mental health. Will you vote in support of a health care bill that enforces stronger parity requirements for mental health care coverage versus non-mental health care coverage?
Yes, of course.
Thank you. Surprise billing. Will you vote in support of a health care bill that eliminates surprise out-of-network billing?
Yes.
Thank you. And then the last question, the key question. Will you, on behalf of your constituents, prioritize the passage of a comprehensive health care bill with House leadership, which includes the issues mentioned tonight, before the end of the session in July 2020? And will you report back to your constituents who organized this meeting within several weeks?
Yes.
Excellent, thank you. That is positive. That is very positive. Thank you. Now it's your time to elaborate any of the issues you want regarding health care. If you'd like to do it, please, starting with you.
Well, thank you. And I want to thank the group and everyone here for inviting us to come, and also for the work that you've done. I know it's been going on for a long time. I have friends that are in other chapters, if you will, and talk to me about how much work they've been doing. And it really helps us as legislators to focus in on what's important. So thank you. It's a partnership in getting change done. And thank you for doing your part. And we're going to do our best to do our part. I want to tell you a little bit about what has been done recently. The current fiscal year 2020 budget authorizes Mass Health to directly negotiate with drug manufacturers while maintaining members' coverage. These reforms enhance accountability and transparency of drug pricing. They also give Mass Health greater negotiating leverage for prescription drug pricing. Mass Health is also implementing requirements to limit pharmacy benefit managers' margins and spread pricing, which increase costs. Together, these Mass Health initiatives are projected to save the state $80 million during this current fiscal year. Now, there's three main bills out there. The Governor Baker's healthcare bill subjects manufacturers of new high-cost drugs to Health Policy Commission's accountability process for further review, similar to insurers and providers. It imposes a penalty on manufacturers that increase the cost of drugs exponentially, which are sold or distributed in Massachusetts. And it increases state oversight of pharmacy benefit managers. It establishes a privacy benefit management certification requirement and requires PBMs to report financial data to the Center for Health Information and Analysis, SHIA, if you're familiar, from providers and manufacturer payments. The Senate bill allows a state health policy commission to analyze the price of drug costs over $50,000 a year in drugs that fall on the World Health Organization's list of essential medicines. Now, the House bill, House 1133, provides transparency strategies around the underlying production of costs of prescription drugs. It restrains abuses of pharmacy benefit managers, authorizes the Health Policy Commission to set limits for high-priced drugs, and requires pharmacies to inform consumers of lower-priced alternatives, which is important that we heard tonight. It also gives Mass Health additional negotiating tools to strive for lower prices, drug prices. Now, with regards to mental health, I will vote for the healthcare bill that enforces stronger parity requirements for mental health coverage versus non-mental health coverage. I voted for the House bill that's in Financial Services Committee. Now, all three of the bills that I mentioned, the main bills, improve access to care, identify gaps in coverage, require insurance coverage for emergency room visits, eliminates need for prior authorization for patients in crisis, and require and enforce mental health parity. With regards to surprise billing, emergency visits, as we all know and we heard about today, often result in expensive services outside the patient's network. The House bill requires health plans and providers to disclose info to consumers about the network status of providers. It also requires specific patient consent for out-of-network services and prohibits providers from billing consumers more than their in-network cost-sharing amount. So, as you can see, they're all pretty much on the same page. And, we came close to passing a healthcare reform bill last year, but there were differences between the House and Senate, and it just didn't happen before we came to the deadline. I think there's a really good chance that this will happen this year. We're going to push hard for it. As Michelle mentioned, we're having the transportation policy debate over the next week, and then a debate over the capital improvements for transportation throughout the state. And we have the state budget coming up, and then there's a number of other controversial issues that we believe, based on what's been happening in the House and out in the communities, will be brought up as well. So we can never guarantee what is going to be brought up before the end of the session, but I will definitely work very hard with my colleagues here to ensure that a comprehensive healthcare bill with the provisions that we outlined here and that all of you talked about will be taken up this session. And just one last thing, I appreciate the personal stories, and we hear those from our constituents directly, and we hear them at our public hearings at the State House, and it's frustrating for us to not be able to take care of things right away, but it's sometimes an excruciating process, and eventually we get there, and hopefully, this will be the year. Thank you.
Thank you very much. We look forward to working with you. We look forward to getting something done this year. Appreciate it very much.
I'd like you to stand up. Rep Stanley, I want your constituents to see you. You were sitting this whole time. You guys do things right. And I encourage you to stand up when you speak so they can see, your constituents can see you speak. Thank you.
Michelle.
Well, good evening, everyone. I'm really thrilled to be here with all of you, and I want to thank GBIO for hosting this really important meeting. You know, as Tom said, it is incredibly helpful for us to hear your stories, because when we hear your stories, we can bring your voices to Beacon Hill, and we can provide real examples of real people and the struggles that everyone is having with our healthcare system. And that makes our policy decision-making process a vastly improved process. So I really am grateful for your organization, the skill that you have in navigating this issue, and for bringing us all together. And that was really what I was excited about to come tonight, was to hear the stories. So as the newest member of the delegation, I've been a rep for, a little bit over a year. And healthcare is a wee bit complex, and healthcare financing in particular is really an issue of great depth, and it's like a big maze, right? I am fortunate to sit on the Public Health Committee, but I don't sit on the Healthcare Financing Committee, and many of the bills that are being dealt with in this issue are going through the Healthcare Financing Committee. Tom described some of the major bills to you, and I will just add that some of the things that struck me as interesting, the governor's bill in particular is putting a much greater emphasis on primary care and mental health, and I thought that was extremely important, that we all recognize that we have to do more to keep people from getting sick to begin with, and to provide them the mental health and behavioral health care services that they need. So I looked over some of the bills that you asked me about and some of these questions to just give you a little bit more specificity. And with respect to drug costs, I am a co-sponsor of Rep. Barber's Bill H1133, which is an act to ensure prescription drug cost transparency and affordability. And you know that the Senate passed, Senate 2409 is now in House Ways and Means. And that's an act relative to pharmaceutical access cost and transparency. So that is making some movement and some progress. With respect to the $25 cap and sort of preventing the out-of-pocket spending from growing too large, there aren't specific House bills that I know of that will do this, but there is the Senate bill S-2425, an act relative to emergency insulin access. And that was reported out by the committee that I sit on, Public Health, favorably, and I was really pleased to vote in favor of that one. We are very lucky in this district to have Senator Cindy Friedman as one of our two senators here in Lexington, and she's a real leader on healthcare, and she's been rolling up her sleeves and working on mental health issues in particular. And the bill, Cindy Friedman's bill, which is going by ABC, addressing barriers to care, has passed the Senate and is moving forward, and that's something that I'm hoping we will see in front of the House, because it's a great bill. And when I read the summary of the 5 or 6 very detailed things that bill will do, it gives me a lot of hope that we can have some progress on mental health. So on surprise billing, I'm a co-sponsor of an act to protect consumers from surprise medical bills, which is H967, Rep. Farley Bouvier's bill, and a co-sponsor of an act to increase consumer transparency about insurance provider networks, H913. And I think that one actually was passed by the House in part of an omnibus bill on children's wellness. So we actually passed that one, which is great. Prior to being elected as a member of the House, I was on the Board of Selectmen here in Lexington for almost 2 terms, and we spent a lot of time working on a mental health and wellness task force, because we recognize how critical this issue is to all of our residents. And I was really pleased to bring a group of people together in a coalition to figure out what we can do locally to improve health and mental health in particular. And one of the things that I'm kind of excited about is tomorrow we actually have a health bill coming before the House for passage, and I'm certain that if they were going to bring it to us, they're pretty sure it's going to pass. And that will provide boards of health with greater training, and there's about 3 or 4 things that the bill does. It also provides grants for cities and towns to assist their health departments in improving public health, and it provides the training, provides the grants, and also sets standards for what we want to see all of our cities and towns doing in the public health world, which is a big step forward. Right now, there's a great discrepancy between what one town offers and another town or city offers. So that's a very exciting bill. It's not specifically getting at healthcare financing, which many of your questions addressed, but it is a step in the right direction. So I am thrilled to continue working with you all. I hope that you bring your voices to me. I'm available anytime. Call, send an email, and I want to hear your stories and get your input. Thanks again for having me.
Thank you very much. As you know, GBIO doesn't go away, so we'll be back in touch. Ken, please.
Thank you very much. Thank you for including me, and thank you for including me on this wonderful panel. My name is Ken Gordon, and I'm the state representative from Bedford. I represent Burlington and a precinct in Wilmington, and also a member of Temple Isaiah. Thank you, Don. And it's a pleasure, like I said, to be with my colleagues here. Representative Socolo, she said this is her first term as a state rep, but she's come in, she's come in running, and she's done a great job for the people of Lexington. How many of you live in Lexington? Most of you? Yeah, so you've got a great state rep. She was great from day one. And Representative Stanley, do some of you live in Lincoln, or in some few of you, or Waltham? So he does a great job for you as well. And it's just, we go to work, and what we do is we try to solve problems. And coming to events like this highlight the problems that you elect us to solve. And these are crucial problems. And in my opinion, you start off with the premise that healthcare, including healthcare, is a human right. And I think all of us, thank you. So, start with that. Start with the fact that if a person is having a heart attack and they go to the hospital, they're going to get treated. Right? There may be some forms eventually, but they're going to get treated. And then, and with respect to mental health, and the reason that we need mental health parity is the same should be true with a person suffering from a mental health crisis who shows up at a hospital, should be immediately directed to a hospital who can care for that person. It should be no different. So the rest of this is just a conversation about how we pay for it. And that is a conversation we should be able to solve, because all of us agree on the problem. All of us agree that it is a problem. And I think one of the most significant moments that occurred today was when all of you stood up, when Dawn said, stand up if you are affected by any of these problems or you know someone who has. And we have. And up here, we stood up, because when we spoke to each other, we have too. It was just this morning that I was on the phone with Express Scripts, who was trying to tell me why my 90-day, my daily prescription that was prescribed to me, I can only get 18 over 90 days. And they were trying to explain to me why that's appropriate. And my doctor says I'm supposed to take one a day. I can do math. This is not going to work. But I live in your world, right? And this is what I love about being a state rep, by the way. We get to be here with the people that we represent. We're not on TV. We're not some faraway place. We're here with you, and you're here with us, and we can interact on these issues. But as to this, we're no different. I have my son, and I don't. I'll keep this vague, but he has a problem with ADHD, and after seeing a therapist for a couple of months, was told, I'm sorry, I no longer take your insurance, and we're ending our relationship. It's difficult to be able to create a relationship between a therapist and a child, where the child is finally able to discuss issues, and then to have that therapist say, no more. Insurance company, they rule, right? They're making the decision. They don't take my my plan. They've dropped me from their plan. Therefore, I'm dropping you from my from my care. And that's what happens every day to all of us, not all of you, all of us. And so these are problems that we will continue to address. We were very close, as Representative Stanley said in the last session. My colleague and my classmate, Representative Roy, was the acting chair in healthcare finance. And as he put it, he said, I feel like I was just hit in the gut when on that last day of the session, we couldn't come to an agreement with the Senate. And that's not to blame the Senate, because we all have our ideas on how best to solve the problem. It's just too bad that in a legislature where we're all elected officials, so we all come in with our ideas, but eventually we should be able to compromise, to get ourselves in a room and compromise and come out with something that we can show the governor. We will continue to work on it. We learn from what we've done in the past. We build on what we've done in the past, and we will continue to do that. So all of these bills likely will come together as a comprehensive healthcare finance bill and address all of this. In my last minute, I'll tell you that tomorrow I'm getting on a plane. I'm on a commission with your Senator Friedman, to bring a restoration center here to Middlesex County. And this will be a place where a person suffering from untreated mental illness or substance abuse can be taken by the police as an alternative to an emergency room where they don't belong, as an alternative to the criminal justice system where they don't belong. And so we were authorized through the Criminal Justice Reform Bill to identify the best way to do this. And one of the ways we're doing that is to find facilities in other parts of the country that are doing it, and we'll take notes and bring our best ideas back here to Middlesex County. It's another example of the progress we are making in treating mental health illness, especially in this case. It's not a criminal situation. They shouldn't be there. It's got to be a place that people can go in an inviting session to get their conditions addressed. So thank you. We'll continue to work on these issues.
Thank you. Thank you, representatives. Thank you for sharing your stories with ours. It's remarkable that we all share some connection to these problems, these injustices that we deal with in the healthcare system that we're stuck with at the moment. So we're hearing these stories, and we're feeling the necessity of taking action, doing something about it, so we don't have to hear these stories anymore. There's many others, by the way, there are many other stakeholders in this whole battle to make things right. I mean, there are the biotechs, there's the pharmas, there's the insurance companies. These are stakeholders that are going to probably, our representatives are going to hear from. But we are the only group that brings ordinary people to tell their stories. And we're so proud of that as members of GBIO that we can do that. So we fully expect our representatives to follow through on the commitments they've made tonight. Thank you so much for that. All three of you with yeses for all of our commitments. And we've heard our reps say that they commit to working with the House leadership to get a bill on the floor so we can have a joint health care bill before the end of this session. Thank you for that. That's so important that you work with the leadership to make this happen. But it's not just on them to act. You know, it's up to us too. We need to do our part to empower these reps to act on our voices. So to that end, I'm going to ask all of you to please take out the two-sided letter that you received when you arrived tonight. Does everybody have that? Does everybody have that letter? It's the letter to the House leadership. If you don't have it, raise your hand. We'll get one to you. We have a bunch of people that do not have the letter. Let's get those letters out. This letter with your signature will be passed on to your representative and delivered to the State House with hundreds of other letters collected at other GBIO in-district meetings like this one. If you believe that the Mass House of Representatives needs to move quickly to advance health care reform legislation, we're asking you to sign this letter. If you know who your rep is, just make sure your address is on the back of the letter and it's clearly printed, and we'll get it to that rep. If you're here if you're here and these are not one of your reps, we'll send it to the right rep. Just get your address on the back. Okay, good suggestion. Rep Stanley is suggesting that you be sure to put the email addresses on the letter. Is there a space for that? There is a space already on the letter. That's great. So although this letter that you're looking at and signing, hopefully, focuses on the three issues we talked about tonight, this doesn't mean that there are not other important issues out there. So if you have other questions or concerns, or if you have a story you want to share with your representative, there's a space in the letter to do that too. So does everybody have a pen or pencil to do this with? We have some pens that we could circulate. Everybody, put your hand up if you need a pen. Okay, great. So read them, sign them, make sure your name and address is on the back, and email, thank you. And when you're finished, raise them in the air. We'll come around and collect them. So when you finish, just put them up in the air. We have people walking around, my lovely wife, my GBAO colleagues. We're going to take a few minutes for you to read the letter and sign it. We'll give you a minute or two for that. What time is it? Okay. Doing really well. Hi.
I'd like to talk to everybody about
I'm sorry, this isn't the right night. It's not an open mic night. I'm sorry.
Okay.
Okay. Sorry. Come on, let's get those letters up in the air. Come on, where are they? Did you sign a letter? Did you sign a letter? Did you sign a letter? I was just informed by our GBAO organizer over here that we now have a count of 70 people at this meeting. Any other letters? Wave them high. I'm going to continue talking. Just keep the letters up in the air, and we'll collect them while I'm talking. But I just want to say that we're almost finished with this meeting. We constituents need to thank these representatives for meeting with us tonight. Let's hear some appreciation. Thank you, guys. Thank you. And we also want to thank our storytellers, Laurie, Ellen, and Wendy, for telling their heartfelt stories. Thank you. Thank you for that. And I want to acknowledge the team that organized this meeting. Besides Jim and me, Robin Kuttner, Debbie Wengervitz, Bill Prenowitz, Evie Measurement, and of course Wendy Tanahashi Works have all been part of making this night happy. Make no mistake, this is important and sacred work that we're doing here tonight. With GBIO, our efforts are based on the values of our respective faith traditions, which compel us to act when we see injustice. In my Jewish tradition, we call this tikkun olam, or repairing the world, and we're commanded to make the world a better place for all. So what will happen after tonight? Please note, this is not a one-off event. This is the start, not the finish. This is just the first step in achieving meaningful healthcare reform. Next, we're going to be reporting back to our congregations about what we heard tonight at this meeting. Then we'll be following up in 2 weeks after we speak with our representatives and hear from them what they've been doing. And we'll be keeping you all updated, so stay tuned. But it all starts with tonight. We're asking you to take these issues home with you and talk about them with your friends, your family, and with your fellow congregants, and tell them what you've heard here tonight. Because with your help, we can make change real. And now I'm going to introduce my rabbi, Rabbi Rachel Maiman, who's going to close us out with a prayer. Rabbi Maiman, you need a mic?
I'd like to share with you just a few words from one of my favorite teachers, Rabbi Jonathan Slater. All prayer, when we pay attention, whether personal or liturgical, is ultimately a form of speaking the truth. It makes us aware of what is going on in our lives in this moment so that we can see clearly and respond appropriately. Tonight, we have spoken truths. We have heard truths. The truth of our fellow human beings, of their stories, and of all of our stories. Let us pay attention and continue to speak our truths through words of prayer. We pray not just for things to be okay, but for our health care to be better, for better care when we are in pain, for coverage when we are suffering, for lower costs when we are sick, and for no more surprises when we seek healing. And just as we have paid attention to stories and people and words, so too let's bring our attention, our truth speaking, our truth hearing, our awareness, our bearing witness into each and every day of our lives, that we may never have to look into the eyes of a loved one who is suffering because of inadequate health care. Never again have to hear these truths, that we may work together to create more and better care, so that our awareness, our attention, our intention, our voices, and our truth may help heal this broken world of ours. Amen.
Amen. Amen. Thank you. Thank you. With that, our meeting is officially and formally closed. However, we will be holding a GBIO-style evaluation of this meeting in the chapel. Is that the chapel there with the pizza? Yeah, the Memorial Chapel, and with pizza. So everyone is welcome to join this evaluation if you care to see what we do at GBIO when we end meetings like this. So thank you, everyone. Thank you, everyone. We are so ahead of schedule.